Hi, I'm Gabby. I'll be the nurse practitioner doing your exam today. How are you?
Good, you?
Good. Can you tell me your name?
Brian Jones,
Can you tell me where you're at?
Lima, Ohio.
Can you tell me what you had for breakfast?
Eggs.
Patient is alert and oriented ×3. So first I'm going to start with the head. I would look normal cephalic. Patient is upright. I'm just going to feel. Let me know if there's any tenderness. Okay. So now we're going to move to the neck. Have you look up a little bit. So neck, there's no masses or anything like that present. Trachea is midline. And now I'm going to go ahead and feel your thyroid gland. Have you look down. And then swallow for me. Perfect. And now I'm going to check the carotid using my bell. Have you look that way and hold your breath. And look the other way, hold your breath. Now you're going to check your lymph nodes. So preauricular, postauricular, submental, submandibular, superior and deep anterior cervical, posterior cervical, occipital, supraclavicular. Now I'm going to look at the eyes. Eyes, the sclera is white. Iris is the same color even on both sides. Going to use the light for the red light reflex test. So I'll have you look forward for me. And then we're going to do the fundoscopic exam, which would be easier if the lights were down, but I'm gonna do this for now. Have you look forward. And I'll do the other eye. And then I would see that the optic disc is present and then vascular is good. So we're going to move to your ears. First I'm going to palpate the ears. Let me know if there's any tenderness. No tenderness in the earlobes or the tragus. I'm going to look into each ear. I would be able to see that the tympanic membrane is pearly gray and the cone of light is present. Go to the other ear. Pearly gray and cone of light is also present in there. Moving to the nose, there's no presence of drainage, no swelling, no redness. So you tilt your head up. And no turbulence are not swollen, no redness, no masses. And then we'd move to the mouth. Lips are moist, pink. Have you open your mouth for me? Stick your tongue out. Uvula is midline, no swelling, no redness. And then I'll have you show me your teeth. Teeth are intact. Tongue is midline and fits appropriately to the mouth. So now we're going to move to listening to your lung sounds. So I'll have you breathe normally for me. Then I'll have you lift your arms up a little bit. And then I'm going to listen to your back as well. All lung sounds are clear. No crackles or wheezing present. And then I'm going to check for CVA tenderness. So let me know if there's any pain with this. Any pain? Any pain?
Nope.
Okay. I'm going to feel the chest. Any pain or tenderness with that?
Mm-mm.
Okay. Everything's good there. Now we're going to move to heart sounds. So I would listen to the aortic, pulmonic, herbs, tricuspid, and your mitral. And I would listen to all those again with my bell. So aortic, pulmonic, herbs, tricuspid, mitral. And the point of maximal impulse would be located here. It's fifth midclavicular line. And now I'm going to have you lay on your back. And I'll lift up your shirt. So then first I would inspect, abdomen is flat, and then it doesn't look like there's any masses, anything like that. So I would listen in each quadrant. Active bowel sounds in all four quadrants. Now I'm going to listen to each artery, so aortic. Oh, nope. Yes, aortic, aorta, renal, iliac, and then femoral would be lower. So now I'm just going to press on each quadrant. Let me know if there's any pain or tenderness. Okay, now I'm going to push harder.
No.
Okay, I'll have you sit back up for me. Now I would look at skin and overall appearance. And warm, dry, doesn't look like any abrasions. And then legs, there would be no edema present, no bruising. I would look at both feet, comparing both sides, looking for any like ulcers, none of that present, no redness, no bruising. So now we're going to test your strength. So I put your arms out like this, push up, push down, squeeze my fingers. Okay, now we're gonna do push against me, against me, against me, against me. Okay, so all strength, upper and lower extremities are 5+. Now we're going to do your pulses. So we'll do carotid first. Yeah, and you can put your arms out like this. I'll do both at the same time. Brachial. Radial. Popliteal. I would do femoral right there. Dorsal or posterior tibialis, and then dorsal medius. All are 3. Now we're going to move to your deep tendon reflexes. So I'll have you stick your arms out like this, and then I'll have you just relax. I'll do your brachial. So I'll have you stick your arm straight out like that for me. Brachioradialis. And we'll do that on another side again. So do a tricep. And then brachioradialis, or brachial, or bicep actually. Okay, and then this is the brachioradialis. And then we'll do patella.
Wow.
And then we'll do Achilles, so lift your foot up and relax it for me. We'll do the other one, relax your foot. And each of those, patellas would be 4, everything else would be 2. So then, going to look at this right here, asymmetrical. It would be for borders are good. It's symmetrical on all sides. Color is good throughout, same color. Diameter is less than a pencil eraser. And then how long has it been there for?
Ever.
So no new onset of anything like that.
Mm-mm.
So now we're going to test cranial nerves. So cranial nerve 1, I'd have you smell something. And tell me what you smell.
Peppermint.
Perfect. Cranial nerve 2, I would have you use the Snellen test, which we don't have, but I would check your eyesight. And then 3, 4, and 6, I'd have you follow my finger. Okay. And then 5, is there any tenderness or anything? You feel this here?
Mm-hmm.
And then we're gonna check your sinuses too, so any tenderness there.
Mm-hmm.
Okay. So then 7, I'd have you smile for me. Frown, puff your lips. And then 8, I'm gonna list or say a word and then you repeat it to me.
Apple.
Okay.
Pumpkin.
And then we would move to, I'd have you stick your tongue out, and then that would be, I'll have you swallow, and then stick your tongue out and say ah, and then move your tongue left to right. So that would be 9, 10, and 12, and then have you shrug your shoulders, and that would be cranial nerve 11. I think that's everything.
Very nice.